I'm one of the nurse practitioner students at King University, and I'm going to be doing your head to toe assessment today. What's your name?
Aubrey Madison Reeves.
Okay, Aubrey, do you need to empty your bladder or anything? Okay, I'm going to wash my hands first. Okay, Aubrey, I'm going to ask you, I know you just told me your name. I want you to tell me your name again. What's your name?
Aubrey Madison Reeves.
And what's your date of birth?
November 17th, 2001.
And Aubrey, I want you to tell me who the president is of the United States.
Barack Obama.
And where are you at today?
Pediatric office.
And what is today?
Saturday.
Okay. Aubrey is alert and oriented to person, place, and time. Aubrey has been provided a gown for her privacy, and the door has also been shut for your privacy. Okay. Another thing we're going to talk about now, we're going to start with the assessment. We're going to talk about the nutritional status, the nutritional assessment. We did vitals, and the vitals were good. Your blood pressure was 112/68. Your height was 63 3/4 inches, which means 5'3 3/4. Your weight was 125.6, and your BMI is 23%, which is perfect. That falls within the perfect range for your height and weight and age. Just make sure, since you're doing cheerleading, that you're drinking plenty and everything looks really good. Now we're going to start with your skin assessment, okay? I'm going to kind of just look at you. Skin tone looks even. You're pale in color, but you're dry. Skin is dry and warm. Any moles or anything you're concerned about? Okay, we're also going to do, from the skin assessment, we're going to go, I'm going to continue looking, but I'm actually start with your head also. Good, the head is normal size and shape, no lumps or bumps, no dandruff, and no lesions or moles. All right, good. Now we're going to go to your face. Face looks good, just a little dry. It looks like you've had a little bit of acne that's clearing up now, and I know you told the nurse that you were taking some medicine for your acne. What medicine is that?
Minocycline.
And the dermatologist prescribed that, and I think it's working well for you, so I continue to do that. Let's see, next we're going to look at the rest of you. We're going to go to your back. Back is also even in skin tone, dry and warm to touch and intact. Go down to your legs. Everything looks good there all the way to your feet. Skin tone's even. Okay. Very good. Next, we're gonna, as I go back, I'm gonna go back kind of up to your face because I didn't look at your eyebrows good. I wanted to check them out. They're symmetrical, same size on each side. They're brown, they match your hair color. Your eyelashes are also the same color. Look into your eyes, there's no bulging. There's no redness around your eyes, no edema. I'm gonna look at your conjunctiva. And your blood vessels, everything looks good. No redness, no edema. Everything looks good. Now we're going to go to your nails. And we're going to check capillary refill. Capillary refill is good, less than 3 seconds, and there's no clubbing or cyanosis. We're also going to check your toes for the same thing. No clubbing or cyanosis in the toes. Capillary refill is also less than 3 seconds. Now we're going to move on to your neuro exam. We already know you're alert and oriented to person, place, and time, so we're going to go on to your eyes and make sure your pupils are constricting like they should. Just look straight at me. Very good. Pupils are reactive. They're round and about a 2. Very good. Next, we're going to move on to the cranial nerves, and we are going to start by looking at your face. And I want to see if you can smile. Frown for me. Good. I want you to show me, like, puff out your cheeks. Can you change your facial expressions? Good. These are all testing cranial nerve 7, and those all look good and are intact. Face is symmetric. Everything looks really good. Next, we're going to do cranial nerve 11, which we're going to see if you can show your shoulders for me. Very good. Then we're going to work on superficial touch, and I brought a cotton ball. This is going to test cranial nerve 5. And can you feel that?
Mhm.
Okay, you're going to close your eyes and you're just going to tell me where I'm rubbing with the cotton ball, okay?
Cheek, chin, lip, cheek, nose.
Very good. You did an awesome job of that. Now we're going to go on to your reflexes. We're going to check the patellar reflex. Very good. Boy, you really kicked on that one. Now we're going to check your bicep reflex. Very good. Awesome. You're doing so good. Good job, Aubrey. You're doing really good on the reflexes. Next, we're going to start with your range of motion. And I'm going to have you stand up. And we're going to work on your neck range of motion. I want to make sure you can move your neck good. So I'm going to have you move it to the side. Other side. Go forward. Go back. Now I want you to move it all around right. All the way around. Now left. All the way around. Good. And then next, I'm going to have you do your arms for range of motion. Move them back. Good. Move your arms forward. Then we're going to have you do your elbows down to your wrist, kind of moving in and out. And then do your wrist. Very good. Squeeze your fist. Come on, have you bend over and touch your toes. Very good. Come up, and then I want you to bend back. Very good. Go side. To the other side. Good. Then I'm going to check your back to make sure your spine is in line and there's no signs of scoliosis. So can you bend over for me? Very good. Back is straight and spine is straight with no signs of scoliosis. Now I want to check your gait. So I want you to walk like that. Walk to me. Very good. And I'm going to have you turn around and walk back. Good. All right, I want you to turn around and we're going to do a knee bend. I want to check, make sure these are good. You're going to go down. One more time. Do it. All right, perfect. Okay, now we're going to have you get back up on the table. And I'm going to have you check your, do this for your neurological also. We're going to make sure you can touch your nose finger. Okay, I'm going to have you do the other side. Okay, very good. And then next we're going to move on to your vision. They did a vision test on you and they told me it was 20/20. And you said, I think you told the nurse that you also see the eye doctor once a year. You're not having any problems seeing the board at school. You can see colors normally, all colors. Okay, not having any other problems. Okay, very good. Then next we're going to move on to your nose and make sure your sinuses are doing okay. All right, are you having any drainage from your nose or any allergy issues? Are you having any nosebleeds? Okay, let me see, it looks like your nares are patent. Okay, sniff for me. Okay, sounds clear in there. I'm going to touch and I want you to tell me if you feel any pressure or pain. Any pressure or pain when I do this? Okay. We're going to go on to the mouth now. Open up and smile. Show me your teeth. Teeth look good. You also know to visit a dentist every 6 months. Tongue looks good. Tonsils are barely visible. There's no redness on the palate, no edema, no petechiae, no rashes, no lesions. Lift your tongue up. No lesions under the tongue, and sometimes this is a place they like to hide, but there's none today. Good. Everything looks good. Everything was normal in your mouth. Everything looked, gums were pink. Everything looked really good when we did that. Next, we're going to check on the ears. We also did a hearing test on you, and your hearing was perfect. It was normal. I just want to make sure you know that when you're cleaning your ears, you don't use a Q-tip because that can rupture the eardrum. Also, I want to check and make sure there's no drainage or anything in it right now. And you said you've had no issues with drainage or anything coming out of it, and you can hear okay. Okay, I'm gonna look at this. Your tympanic. Everything, it's opaque in there. There's no drainage, no fluid. Everything looks normal. You're having no pain in the ears. Good. It's opaque over here. No drainage, no redness. All right. So while I'm over here, I'm going to do a whisper test on you to test cranial nerve number 8. I'm going to whisper a word to you, and then you're going to repeat it. Okay?
Yellow. Red.
Yes. Hey, all right. You're doing good, girl. Got it perfect. Now I'm going to look at your neck. We're going to make sure it's symmetrical. Extend it a little bit for me. Good. Then I'm going to start checking your lymph nodes here so you can just, normal. We're going to start under here at your submandibular, and then we'll go to your submental. And if you feel any pain or tenderness throughout this, let me know, okay? Go right here. Oh, those feel good, and they're not tender. They're all like pea size, which is a normal size. I'm sorry you burped a minute in my face, so you couldn't help it, but I got tickled for a minute. But all your lymph nodes, going back to those, they're all like pea size or less, and that's normal, okay? Everything we went behind, we did your occipital. We're also gonna do your supraclavicular right there. They're all normal, okay, in size, and that's good. And you had no pain or tenderness with that, right? Next, we're gonna look at the trachea. Okay, trachea is midline, no deviation. I'm gonna have you swallow. Very good. Not having any problems with swallowing, food goes down well, drinking. I'm gonna check your thyroid. Thyroid, okay. Good. I'm gonna try to take thyroid over here and make sure there's no masses. I'm kind of misplacing it over here so I can look. Thyroid looks good. There's no masses. Can't really feel. Good. I want you to swallow. Swallowing was normal with that. Good. That's excellent. Next, we're going to go to your heart. And I'm going to start with over here in the base, because we're going to go over the precordium. We're going to start here at the base. Heart sound, heart rate, regular heart rate. Normal sounds, we hear S1, S2, which is normal sounds. It's that love dub sound we want to hear. Good. All right, we're going to listen to the apical next. I need to listen to it for a minute, and I hear no murmurs, no extra sounds. Very good. Next time we'll feel your pulses, your radial pulses. And they're beating. I can feel them pounding normally, no bounding with it. And they're a 3+. All right, I'm gonna do your pedal pulses. Okay, that's a 2+, no bounding. Very good. Next, we're going to move to your lungs, and I'm going to listen to your breath sounds, and you're not having a cough or anything, no shortness of breath. When you exercise, there's no dizziness and no chest pain. Is there a history of sudden, I guess, of heart attacks in your family where people just have sudden, like massive heart attacks? All right, we're going to listen to your... Okay, just breathe normal for me. Okay, listen to the back. Okay, take a deep breath. Deep breath. Blow out. Okay. Deep breath. Okay, lungs are clear. No fluid noted, no grills, no crackles. Now I'm going to check the patient for tactile frenitis. Start here, and I'm going to have the patient repeat 99 to me. 99.
99. 99. 99.
Very good.
99.
Everything was normal with that. I did hear the tactile frenitis. All right, so everything was good with your lungs. Next, we are going to move on. I'm actually going to listen to your carotid artery up here. I'm going to feel it first. Regular rate and rhythm, no bounding. Now I'm going to listen, make sure I don't hear any bruise. Good. No bruise noted on listening. Very good. Everything looks normal there, sounds normal. We are going to look and make sure you're not having any jugular vein distension, so I'm going to have you kind of extend your neck a little bit, come back a little bit. I'm going to come over to the side. There's no jugular vein distension noted. I will note that this is usually best done at a 45-degree angle for the patient, but none noted today. So we are going to actually start on your abdomen exam, looking at your belly. I'm going to have you lay down. Sorry, we're going to keep you covered. We actually got a little sheet that we're going to cover the patient up with to protect her privacy. So even when we have to pull the gown up. All right, we're good and covered. Okay, I'm going to look first. I'm going to inspect your belly. The contours with the normal. No bloating. There's no lesions, no scars noted. I'm going to listen next. The bowel sounds. I'm going to note that vowel sounds are normal and in all 4 quadrants. Are you pooping okay? Pooping regular every day and not having any problems peeing also? None? Okay, good. Next, I'm going to percuss. So I'm going to percuss over your belly a little bit. Let me know if anything bothers you, if there's any tenderness, okay? Go up over your liver, and there should be a resonance to a dull sound when I get to the liver. And that was it, and that means you're normal. Your liver is normal size. One more time, I'm going to go up here by the spleen area. You should not be able to feel the spleen. Good. Percussion normal, and I'm going to palpate. If you any tenderness, let me know. Any pain when I'm doing this, okay? No problems up in here, your upper epigastric. Okay, good. All right, I'm going to have you sit up. We're done with that part of the exam. And the last thing I'm going to ask you about will be just, we talked about you do have regular periods, not much cramping. Bleeding is minimal, so we'll keep an eye on that. And the only other thing I'll mention, and I think I told your Nana, was that we will talk about getting the HPV. You haven't gotten that yet, so that's some of the vaccines we do today will be the HPV, the tetanus booster, and Nana has already read over them, and we will do those today at the end. But we are done with the exam, and thank you so much.